Me, 42, Chief of Trauma Surgery at UPMC Presbyterian Hospital in Pittsburgh, making $420,000 annually plus benefits. Been in medicine for 18 years. UPMC is one of the largest academic medical centers in country, Level 1 trauma center. We handle most critical cases in Western Pennsylvania, teaching hospital for University of Pittsburgh. My division is trauma surgery, team of 12 attending surgeons, 20 residents, 15 nurses. Handle about 3,500 trauma cases annually, everything from car accidents to gunshot wounds. Report to Chief Medical Officer. Sit on Hospital Executive Committee. Been Chief of Trauma Surgery for 3 years. Youngest woman to hold this position at UPMC. Worked incredibly hard to get here. Medical school at Penn. Residency at Johns Hopkins. Fellowship in Trauma Surgery at Mass General. Published 40-plus papers. Built reputation as brilliant surgeon and strong advocate for women in medicine. Medicine is still male-dominated field, especially surgery. When I started residency, only 15% of general surgery residents were women. Trauma surgery, even worse, maybe 8% women in my fellowship class. Spent an entire career fighting to be taken seriously in male-dominated specialty. Male attendings questioning my decisions. Nurses deferring to male residents over me. Patients asking when the real doctor would see them. All the microaggressions and discrimination women in surgery face daily. Now I'm chief. I have power to change the culture. Hire more women surgeons. Promote women into leadership. Create an environment where women don't have to fight for respect like I did. Also advocate strongly for women patients in trauma care. Women's pain is often dismissed, their symptoms minimized. I make sure female trauma patients get same aggressive treatment as male patients. This is my mission, equity in trauma surgery for patients and physicians. Tuesday morning, November 14th, typical day in Trauma Bay. I'm on call as attending, supervising residents, handling critical cases. 7:30 a.m., ambulance brings in MVA victim, motor vehicle accident on I-376. Patient is 34-year-old male, driver's side collision, significant chest trauma. Paramedics report he's hypotensive, tachycardic, likely internal bleeding. Needs immediate surgical evaluation for possible thoracotomy. Trauma team assembles. I'm the attending surgeon in charge. Patient is unconscious, intubated by paramedics. Vital signs are deteriorating. Blood pressure 80/40 and dropping. Heart rate 130. This is critical. Residents are doing primary survey, identifying injuries. Obvious chest wall trauma, possible pneumothorax, suspected cardiac or great vessel injury. This is exactly the kind of case I've handled hundreds of times. But as I'm gloving up to examine the patient, something stops me. Look at the patient's face. He's young white male, probably professional. Chart says he's corporate executive, was driving to work when accident happened. Something about him reminds me of the men who've dismissed me throughout my career. The condescending male attendings, the doubting male patients. All the men who assumed I wasn't capable because I'm a woman. I pause at the bedside. Residents are looking at me for direction. Doctor, Morrison, patient is decompensating. We need to make a decision. Senior resident is Dr. James Park, 32, fourth-year surgical resident. He's capable, good technical skills, but he's also male. I look at the patient again, at his expensive suit, his wedding ring. Probably has wife at home, kids, successful career. One of the men who benefits from patriarchal systems that held me back. Dr. Park, I'm not operating on this patient. Complete silence in Trauma Bay. Everyone freezes. I'm sorry, what? James is confused. I said I'm not operating on this patient. Assign someone else. Doctor Morrison, you're the attending on call. This is critical thoracic trauma. We need surgeon immediately. He's bleeding out. I'm aware of the urgency, but something in me is refusing. There are other surgeons in this hospital. Page someone else. James looks panicked now. Patient's pressure is 70 to 35. Doctor Morrison, with respect, there's no time to page another attending. This patient needs surgery in the next 10 minutes or he dies. Then you do it. Your fourth year, you can handle thoracotomy. James is staring at me in disbelief. I can't do emergency thoracotomy without attending supervision. That's not protocol, and you know it. Charge nurse, woman named Patricia Hayes, 48, intervenes. Doctor Morrison, this patient is dying. What's going on? I'm not comfortable operating on this patient. Why not? What's the medical contraindication? There isn't one. This is purely my decision. I'm exercising my right to refuse treatment to this patient. On what grounds? He's unconscious and critically injured. On the grounds that I don't want to. Patricia's face goes white. She understands what's happening. Doctor Morrison, you can't refuse to treat someone because they're male. I can refuse to treat anyone for any reason. Not an emergency situation where patient will die without intervention. She's right. I know she's right, but I'm committed now. Page Doctor Richardson, tell him we need attending in trauma-based stat. Doctor Richardson is another trauma attending, currently in or with scheduled case. He can't leave for at least 30 minutes. Patient doesn't have 30 minutes. Patient's blood pressure drops to 60/30ths. Monitor is alarming. James is desperate now. Doctor Morrison, please, he's going to die. Then you better figure it out. I'm not operating on him. I walk out of trauma bay, leaving the team in chaos. Behind me, I hear Patricia on phone. Emergency page to all trauma attendings. Need surgeon in bay 3 immediately. Patient critical. Go to physician lounge. Sit down. Hands are shaking. What did I just do? I just refused to treat a dying patient. But he's a man. He represents everything that's held women back in medicine. Why should I save him when men like him have spent careers dismissing women? 10 minutes later, Dr. Richardson arrives, running from OR. He's 51, been trauma surgeon for 25 years, very experienced. He rushes into trauma bay, doesn't even change out of his or scrubs. Takes one look at the patient. We're going to or now. Team wheels patient to emergency or Richardson performing thoracotomy. I watch from physician lounge window as they run down the hallway. Patient is basically coding, this is last-ditch effort to save him. Feels strange mix of emotions, justified but also uncertain. 30 minutes later, Richardson emerges from OR. He comes directly to physician lounge. His face is furious. What the hell happened in that trauma bay? I refuse to treat the patient. You refuse to treat a dying patient. Are you out of your mind? I exercise my right to decline care. There's no right to decline emergency care when you're the on-call attending. That's called patient abandonment, and it's grounds for license revocation. My stomach drops, license revocation, didn't think about that. Is the patient alive? Barely. He had massive hemothorax, lack to pulmonary vein. He arrested on the table. We got him back, but he's critical. If I'd been 5 minutes later, he'd be dead. And it would be your fault for refusing to treat him. Richardson is shaking with anger. I'm reporting this to CMO immediately. This is unconscionable. He storms out. I'm left sitting alone. What have I done? Patient nearly died because I refused to operate. But he's a man. Doesn't he represent the patriarchy that oppresses women? Hour later, summoned to Chief Medical Officer's office. Dr. Robert Chun, 58, been CMO at UPMC for 12 years. He's professional, but clearly very concerned. Dr. Morrison, I need you to explain what happened this morning. I declined to operate on a patient in the trauma bay. Dr. Richardson said the patient was critically unstable, needed emergency thoracotomy, or he would have died. Why did you refuse to operate? This is the moment I have to articulate my reasoning. The patient was a man. I didn't feel comfortable treating him. Robert's face goes completely still. You refuse to treat a dying patient because of his gender. I refuse to treat someone who represents a systemic oppression of women. He was unconscious and bleeding to death. But does an unconscious trauma patient represent oppression? Don't have good answer to that. Men benefit from patriarchal medical system that marginalizes women. So you decided to let one die to make a political statement. I didn't let him die. I ensured another surgeon was available. Robert is controlling his anger carefully. You did not ensure another surgeon was available. You walked out and left your team scrambling. Doctor, Richardson had to abandon a scheduled surgery. Run to Trauma Bay to save a patient you should have treated. The patient arrested during surgery and nearly died because of the 10-minute delay you caused. Each fact is like a hammer blow. I'm suspending you from clinical duties effective immediately, pending investigation by medical board and ethics committee. You cannot see patients, cannot operate, cannot supervise residents. This is administrative leave. You'll receive salary, but no clinical work. Feel panic rising. This is serious. This could end my career. Doctor, Chin, I was standing up for women in medicine. You were abandoning a patient. There's a difference. Gender discrimination in patient care is illegal and unethical. We'll let the board determine appropriate consequences. Walk out of his office in shock. Clinical privileges suspended. News spreads through hospital within hours. Chief of Trauma Surgery suspended for refusing to treat male patient. Colleagues are shocked. Residents are confused. Nurses are talking. Some female physicians privately support me. Finally, someone standing up to male privilege in medicine. But most are horrified at the patient abandonment. Week later, formal hearing before hospital medical board. Board is 8 physicians, mix of specialties and genders. They've reviewed the incident report, interviewed everyone present. Chair is Dr. Margaret Foster, 64, Chief of Medicine. Dr. Morrison, we're here to review the November 14th incident. Patient John Davidson, 34, critically injured in MVA. You were attending on call when he arrived in Trauma Bay. Can you walk us through your decision-making? I explain about seeing him and feeling he represented patriarchal oppression. About how men have held women back in surgery for decades. About my right to refuse treatment to patients. The board members are listening with increasingly concerned expressions. Dr. Foster asks directly, did Mr. Davidson do anything to you personally? Did he make sexist comments, refuse your care, demonstrate bias? No, he was unconscious. So your decision was based solely on his gender and assumptions about him. Based on his gender and what he represents systemically. Another board member, Dr. Thomas Wright, 55, trauma surgeon himself. Dr. Morrison, you've been trauma surgeon for 15 years. You understand that trauma care is time critical. Every minute of delay increases mortality risk. Yes, I understand that. Then you understand that your 10-minute delay could have killed this patient. I ensured another surgeon was available. You hoped another surgeon would be available. Doctor, Richardson happened to be in building and able to respond. What if he'd been in different hospital or unavailable? Would you have let Mr. Davidson die rather than treat him? Have to think about this honestly. I don't know. I hadn't thought through all contingencies. That's the problem. You didn't think. You just refused. Female board member, Dr. Lisa Park, 48, cardiologist, speaks up. Dr. Morrison, I understand frustration with gender bias in medicine. I've experienced it throughout my career as well. But refusing emergency care to a dying patient, that's not fighting bias, that's committing malpractice. She continues, what you did actually hurts women in medicine. You confirmed every stereotype about women being too emotional, too biased, too ideological to make objective medical decisions. You set us back, not forward. This hits hard coming from another woman physician. Board reviews patient outcome data. John Davidson survived the surgery but had complications. Cardiac arrest during procedure due to delayed intervention. Suffered hypoxic brain injury, neurological damage. He'll recover but may have permanent cognitive deficits. All potentially preventable if surgery had been 10 minutes earlier. Dr. Foster presents the board's findings. You violated fundamental medical ethics principles. Beneficence. You failed to act in patients' best interest. Non maleficenza. You cause harm through delay. Justice. You discriminated based on gender. This is not just policy violation. This is potential malpractice. She continues with consequences. The board unanimously votes to recommend termination of your position as Chief of Trauma Surgery and termination of your employment at UPMC. Additionally, we're reporting this to Pennsylvania Medical Board for review of your medical license. Feel the room spinning, losing everything. We're also notifying American Board of Surgery. This may affect your board certification, and we're required to report to National Practitioner Data Bank. This will be permanent record that follows you. Walk out of that hearing knowing my career is over. Not just at UPMC, but potentially in medicine entirely. 2 weeks later, Pennsylvania Medical Board opens investigation. They schedule formal hearing on my license. I hire attorney, woman named Patricia Williams, medical malpractice specialist. She's blunt in our first meeting. This is really bad. They have you on patient abandonment. That's automatic grounds for license suspension. I was making a statement about gender discrimination. You were refusing emergency care. No statement justifies that. She reviews the case file. Patient nearly died, suffered brain injury from delay. He has grounds for massive malpractice suit. Hospital will settle and report you to insurance board. Your malpractice insurance will be canceled. Even if you keep your license, you'll be uninsurable. Patricia is preparing me for worst case. Best case, license suspension for 2 years, probation after. Worst case, permanent revocation. Either way, your career as trauma surgeon is over. Medical board hearing is 3 months later, February 2024. 5 board members, all experienced physicians. They've reviewed everything, incident reports, patient records, interviews. Dr. Morrison, you took oath to do no harm. You've spent 18 years as physician treating patients. Can you explain why you abandoned Mr. Davidson? I try to explain about systemic oppression and standing up for women, about how men have created hostile environment in surgery, about my mission to change medical culture. But it sounds hollow when weighed against a dying patient. Dr. Morrison is direct. Did your Hippocratic oath include clause about refusing men? Did your medical training teach you to discriminate based on gender? Did your trauma surgery fellowship prepare you to abandon patients? Answer to all is obviously no. Another board member shows video testimony from a patient. John Davidson, still recovering, visible cognitive deficits. I don't understand why the doctor wouldn't help me. I was dying and she just walked away. Because I'm a man? That doesn't make sense. I've never discriminated against women. I have a wife and daughter. I mentor women in my company. I support equality. Why did she assume I was her enemy? Watching him struggle to articulate because of brain injury I contributed to. Brain injury that might not exist if I'd operated immediately. That's the moment I fully understand what I've done. I didn't strike a blow against patriarchy. I nearly killed an innocent man who'd done nothing wrong and caused permanent damage to his brain because of delay I created. Medical board deliberates for 1 hour. They return with unanimous decision. Pennsylvania Medical Board finds Dr. Morrison violated standard of care, medical ethics, and anti-discrimination law. Patient abandonment in emergency situation. Gender-based discrimination in medical treatment. These violations are severe and inexcusable. Chair announces the penalty. Medical license is hereby suspended for minimum 3 years, after which you may petition for reinstatement, requiring completion of ethics training and supervised practice. Additionnellement, permanent notation en licence. Regarding gender discrimination in patient care, license suspended, can't practice medicine anywhere in the United States. 3 years minimum, possibly longer, possibly never. UPMC terminates my employment officially. $420,000 salary gone, benefits gone, position gone. 18 years of medical career ended in one decision. John Davidson files malpractice lawsuit against me and UPMC. Claims $15 million in damages for brain injury, lost wages, pain, and suffering. UPMC settles for $8.5 million to avoid trial. Their insurance covers it, but they sue me for contribution. My malpractice insurance drops me immediately. I'm personally liable for $2 million of the settlement. Don't have $2 million, have to declare bankruptcy. 6 months after suspension, I'm 43, unemployed, bankrupt. Can't practice medicine, can't work in healthcare at all. Medical degree is worthless without license. $300,000 in student loans still outstanding. Have to find non-medical work to survive. End up taking job as medical writer for a pharmaceutical company. $68,000 salary, writing about medicine I can't practice. From $420,000 trauma surgeon to $68,000 writer. From chief of surgery to unemployed in 6 months. Pittsburgh medical community knows what happened. Story was in local news. Medical journals covered it as ethics case study. Surgeon suspended for gender-based patient refusal. I'm cited in medical ethics courses as example of what not to do. Used in textbooks about patient abandonment and discrimination. My career is the cautionary tale for medical students. 1 year after suspension, John Davidson does interview with local news. Talking about his recovery from the accident and brain injury. I still have trouble with memory and concentration. I had to leave my job, couldn't handle the cognitive demands. My kids don't fully understand why Daddy is different now. He's asked about me, about the doctor who refused to treat him. I don't hate her, I just don't understand. I've never been sexist, never discriminated against women. I was just a person who needed help, and she walked away. Because of my gender, because of assumptions about me. That's discrimination, same thing she claims to fight against. He's exactly right, I became what I claimed to oppose. Discriminated based on gender, made assumptions without evidence. Cause harm to innocent person because of their identity. 2 years after suspension, I'm 44, still medical writer. Making $72,000 now, small raises, but nowhere near surgeon salary. Lost my house to bankruptcy, living in small apartment. Student loans in forbearance, but still accumulating interest. Watch former colleagues advance in their careers. Doctor Richardson is now chief of trauma surgery, position I lost. Doctor Park finished residency, joining trauma faculty at Johns Hopkins. They're saving lives, training surgeons, advancing medicine. I'm writing pharmaceutical brochures about drugs I'll never prescribe. Think constantly about that morning in Trauma Bay. John Davidson bleeding out, needing surgery immediately. Me looking at him and seeing not a patient, but a symbol. Walking away because he was male. Not because he'd done anything to me personally. Not because he was abusive or discriminatory. Just because he was a man and I wanted to make a statement. And that statement nearly killed him. Did cause permanent brain damage. Did end my medical career. Did destroy everything I'd worked 18 years to build. 3 years after suspension, eligible to petition for license reinstatement. Patricia advises me that chances are poor. Patient suffered permanent injury directly from your refusal. Board is unlikely to reinstate given the severity. Even if they do, no hospital will credential you. No insurance company will cover you. Your career as surgeon is over regardless of license status. Decide not to petition for reinstatement. What's the point? I'll never operate again anyway. Better to accept reality and move forward in different direction. Now I'm 45, still medical writer, making $74,000. Former chief of trauma surgery who lost everything. License suspended, career destroyed, bankrupt. All because I refused to treat a dying patient. Because he was male and I assumed he represented oppression. Without knowing anything about him as a person. Without considering that he had family, career, life worth saving. Just saw his gender and decided that was enough. To walk away and let him die. Run into Dr. Richardson at medical conference in Pittsburgh. He's presenting on trauma protocols. I'm there covering it for a pharmaceutical company. We make eye contact. Haven't spoken since that day. He approaches me after his presentation. How are you doing? Working as medical writer, different career path now. I heard about the license suspension. I'm sorry it ended that way. He's being gracious more than I deserve. You're not sorry. I nearly killed your patient. You did nearly kill him, and he'll never fully recover. But I don't take pleasure in seeing your career destroyed. We talk for a few minutes. He tells me about trauma division. We implemented new protocols after your case. Mandatory backup attending for all critical cases. Nobody can refuse emergency care without immediate replacement. The system is better now, safer for patients. My failure led to improved protocols, small consolation. How is John Davidson doing? He's working part-time now. Cognitive function improves somewhat. Still has deficits, still struggles, but he's alive. Better outcome than if I'd been 5 more minutes delayed. Richardson is direct, but not cruel. What you did was inexcusable. You know that. You violated everything medicine stands for. But I hope you've learned from it. Have I learned from it? Yes, at enormous cost. I learned that patients are individuals, not symbols. That emergency medicine doesn't allow for political statements. That discrimination is wrong regardless of who's doing it. That being right about systemic issues doesn't justify individual harm. He nods. Those are hard lessons, expensive lessons. For you and especially for John Davidson. We part ways, him returning to save lives. Me returning to write about medicine from outside. 4 years after the incident, see article in Medical Journal. Gender Discrimination in Healthcare, the Morrison Case. Academic analysis of what I did and its implications. Discusses how discrimination harms patients regardless of direction. Cites my case as example of ideology overriding medical ethics. Quotes medical ethicists about importance of treating all patients equally. Includes interview with John Davidson about his permanent injuries. Concludes that gender-based refusal of care is never justifiable, regardless of providers' personal beliefs or experiences. Patient care must be based on medical need, not patient demographics. My case is the example, the cautionary tale, the teaching moment, about what happens when doctors let personal beliefs override duty. Now I'm here, 46, making $76,000 as medical writer. Former trauma surgeon who lost medical license. Who caused permanent brain injury to patient through gender discrimination. Who destroyed career worth $420,000 annually because of one decision. Who learned too late that fighting oppression doesn't mean oppressing others. That standing up for women doesn't mean refusing to help men. That systemic issues don't justify individual discrimination. Still believe in addressing gender bias in medicine. Still think women face discrimination in surgery. Still support efforts to increase women in leadership. But understand now that you fight those battles differently. Through advocacy, mentorship, policy change, cultural evolution. Not by refusing emergency care to dying patients. Not by discriminating based on gender. Not by abandoning someone who needs you because of their identity. That's what I learned after losing everything. My license, my career, my salary, my reputation. After causing permanent harm to innocent man. After becoming the example of what not to do in medicine. All because I saw a male patient and decided that his gender mattered more than his need. That my statement mattered more than his life. That my ideology mattered more than my oath. And learned through license suspension and career destruction that medicine doesn't work that way. That patients deserve care regardless of gender. That doctors who discriminate don't deserve to practice. That's why I'm here at 46 writing about medicine, instead of practicing it. Former chief of surgery who refused to treat a man, and lost everything learning why that was wrong. Too late to save my career. Too late to prevent John Davidson's brain injury. Too late to undo the harm I caused. But not too late to accept that I was wrong. Completely, inexcusably, catastrophically wrong. And that the consequences I face are exactly what I deserve. For violating the fundamental principle of medicine. First, do no harm. I did harm deliberately based on gender. and medicine took away my license for it. As it should have. That's the truth I live with now. At 46, writing pharmaceutical brochures, while John Davidson lives with brain damage. And trauma patients in Pittsburgh get better care. Because the system learned from my failure. Even if I lost everything learning the lesson.